Are you having joint pain in places like your knees and your shoulders, but you're not finding much relief with the treatments that you're doing right now? Well, our next guest, she has a different option for you. This is Sarah Slade of Slade Wellness, and she's here to tell you how she can help with joint pain. And you are using regenerative therapy. That is a term we talk about a lot on this show. It's very popular. What is it?
So regenerative therapy is best known as stem cell therapy, but there's so many other really amazing components that go with it. There's these little molecules called exosomes, and they're really hot in the research community right now because they've been found to be able to actually send signals or communication from cell to cell. So when they're injected right along with the stem cells, it kind of rallies the troops and brings in even more healing factors. So you have the stem cells, you have the exosomes, you have cytokines, other proteins and growth factors, and then hyaluronic acid. So you're getting this rich array of healing factors altogether, not just the stem cells.
Right, and it's your body kind of working, with you. It's not like a medication or anything like that.
Correct.
And I want to talk about the joint issues. We talked a little bit about the shoulders and the knees. What joint issues is regenerative therapy best used on?
Well, any type of inflamed, damage, even missing tissue, it can just whatever's needs to be regenerated, it can go in there. That's what stem cells do. They can turn into whatever tissue needs to be regenerated.
All right, so it kind of can go in and mimic what that area is missing.
Correct.
And you were one of those patients. You had some knee, you're so young. I was like, what do you mean? You had arthritis?
Well, I've always been super active, played sports since I was 4, hiking, active at the gym, and 2 years ago I got some really bad pain in both of my knees. Anything that was an inclined motion would just set me off, so I really had to modify and actually stop hiking. So I decided to have this therapy myself, and 4 months later I went hiking in the Grand Canyon, not understanding how crazy that hike is. But afterwards, my knees were the only part of my body that didn't help.
Didn't hurt. And you said you were told that you had early set arthritis.
I was diagnosed with early onset arthritis, which is narrowing of that joint space. And when it narrows, it causes that friction and that pain.
So walk us through a treatment. What is it like?
Okay. So if you were to come to my office, I'd go through a rigorous health screening and a physical exam. And then if I find that you're healthy enough and qualified for the procedure, I'd have you sit on my treatment table, and whatever joint that we're going to inject, I'd prep it, meaning I'm going to clean it really well with betadine or alcohol to make sure that we don't introduce any more infection or anything. And then we will do the injection, which does cause pressure or a deep cramping, but most patients find that that's minor compared to all of the pain that they've been through.
And you said, how quickly will we see results in some cases?
With the knees, it's really, really quick. Within about 4 weeks, we see a significant reduction in the pain and a return of range of motion and function.
And let's talk safety and quality very quickly.
Super important. Those are my top priorities as a provider. I have gone to extensive research and vetting my suppliers that they follow rigorous quality control standards.
All right, wonderful information, Sarah. Thank you, and I'm glad you're back to hiking and doing all the things you love. Maybe you have a setback. Give Sarah Slade Wellness a call. They do have a special offer for you this morning. Call now for a complimentary consultation. That is a $149 value. And also ask Sarah about her special year-end pricing. They are located at 33 North Lindsay Road, Suite number 104 in Gilbert. To book an appointment, 480-653-5383 or visit sarahsladewellness.com for more information.